Healthcare is the great equalizer. I think that's how I think about it. I was born in a different country. I was born in Lahore, Pakistan, and before coming to the U.S., lived in Canada. Moving back and forth, we lived in 11 different cities to have the opportunities that I do today. That's my family's path here. My grandmother was one of the first female physicians in the country of Pakistan.
Whoa.
What a cool person, right?
No
And
kidding. Why isn't she on this show? Move aside, dude.
that's seriously, I always
I'm
talk
wasting
about
my
how
time.
I always knew this was a stepping stone to her, so I
Yeah,
understand.
that's
You
okay. You
know,
got to bridge the gap. Yeah.
my grandmother passed a few years ago, but she's such a wonderful person with an amazing legacy, right? Like that I get to point to as everything I'm building and get to see how hard and how wonderfully she worked for so many years. And the health inequity piece was, we talk about it today here in the US. I got to see it firsthand as well, where, in Pakistan, a country that was still in its early stages at that time, um, facing a lot of issues around not just access to care generally, but also the differences in how women could access care versus men. So just a very fundamental shift in how healthcare affects everybody. And yet there are all these artificial segmentations that we still face today here in the United States. So we started with the mission of going straight to those underserved communities because I got to see firsthand what inequity can do and how it can impact people. And at the same time, the mission is kind of bigger than just 67 million Americans that we focused on right now initially, and a small number, I know.
Yeah. Just like a
Again, why am I
sixth of the
wasting
whole
my time?
country. Right. No big deal.
But it impacts it's the same system, right? The system doesn't change. We've kind of artificially siloed everybody into these different communities, different geographies, different policies and care. And we just uh, thought about it in the sense of what if we took out these artificial barriers and just made it one healthcare system? It sounds like common sense, but that's just not how the structure is set up so far. And it's quite a shame. So, for us, that's our mission. And that's what we've been building with the technology first, but not virtual first platform in healthcare.
Makes sense. So when a lot of people like myself, we think about healthcare, I think of something that feels unsolvable in this country. And it's a weird dichotomy because in other countries like Canada, Sweden, that have universal healthcare, it seems easy on the one hand to say we should just invest in universal healthcare, which I personally believe in. But then on the other hand, it seems impossible to change the way that the United States is run, largely because of political reasons and what I can only assume is greed and power and money from the highest levels of our system, right? So, what on earth made you think that you could make a dent in this monstrous behemoth that is our institutionalized healthcare system, if you can call it that?
Yeah, that's such a fantastic question because I think it gets to the heart of why we are where we are. And actually, before I answer your question, which is a fantastic question, I actually want to turn it back on you. What do you think defines success in creating, and we always call that fixing healthcare. What does that mean to you?
I think one of the things that I've noticed and that a lot of people who I know haven't experienced is that I lived in Europe for 9 years. I lived in another country. So I've seen how two different healthcare systems work. And I've seen the incredible difference. My wife is European. And I am constantly amazed at how complicated and difficult things are here that are just easy and not a concern. Here you have to wonder, oh, do I go to the right emergency room? Which one does my insurance cover? Does my insurance cover urgent care but not an emergency room? They cover me if I'm admitted or if I'm not admitted. When do I need to bring my doctor in and when do I go straight to somebody who I don't know? In many European countries, and I assume Canada as well, you don't have those kinds of questions ever. If you're sick, you go to any doctor, you will be taken care of. You never, ever have to worry about whether it's going to break the bank, whether you're going to get $1 million or €1 million bill in the mail. You don't have this giant question mark about what is actually covered and what's not covered. Will you get the care you need or will you not? It's just a given. And that's what I think of when I think of universal healthcare. So to me, I think that a citizen of a country, this is my personal opinion, a citizen of a country as powerful and great as the United States should never have to ask questions about whether or not they can get health care, what kind of care they should need, and nobody should ever be put in a position where they don't get health care because they're afraid that it will bankrupt them with a kind of debt that they can literally never get out of the rest of their life. So I think of success as being the opposite of that for all
That's an
people.
amazing take, Ross. Can I try to sum it up, what you
Yep,
just said?
please.
It's in peace of mind. Does that seem
Yes,
like a
I
fair way
think
to
so. Yeah.
define it? Yeah, I think that's fantastic. Now let's talk about a couple of the stakeholders, as the technical term there that we talk about in healthcare. We have the providers that actually, I'm going to lump everybody, all the wonderful staff, the nursing, the physicians, everybody into providers, right? Like they actually provide the care delivery. Then you have in the U.S. Actually, again, like all the countries that you mentioned, there's a payer, whether that's the government or it's a private company. Well, that's kind of, you bucket it as like who's paying for those services, and it's usually not the individual. Now, the individual has the terrible burden of being fully reliant on a system at the worst possible time when they're going through a healthcare crisis, or somebody you love is going through a healthcare crisis, and having the least amount of knowledge about what's happening. The providers at least know what's wrong with you and what you should do. They can throw all sorts of terms at you, but you're not the expert there. And then you have the payers who know exactly what the money is, the codes we talk about, all this stuff.
Right.
And you as a patient are just in crisis looking from one to the other, right?
Right.
So that's kind of, where the lack of transparency really stems from. Nobody's winning. It's an all lose economy right now in healthcare.
Yeah.
We tend to think like it's just the patient, but I think the patient loses out the most. So we build a
Mhm.
patient-centric platform. And for us, it's about bringing everybody into the same place at the same time so that everybody has peace of mind, because now the payers know who's getting the care and what time frame, and with folks that are going to be paid at a reliable amount. Patients know exactly where to go, and they're not going to have to pay something out of pocket. And that's when you start actually building a framework for a more sustainable healthcare economy.
I guess what I want to know is if I show me the before and after. So I'm in one of those communities. I'm in a rural area. I'm part of that group. What is the before for me trying to get healthcare for myself, and what is the after with your system?
Yeah. I'll give you a real example. So, early stages of the company, you as the founder, um, and you're serving as a CEO. You're also the accounting department. You're the billing department and customer support. It's all fantastic.
Sounds familiar.
I was on a call with a couple. There's in their 70s, both of them, very nice. They both had really, they're called high acuity, so like critical need diagnoses at this health center, and they needed care in the community to actually deliver and get prescriptions. They've been at this point when I talked to them, been waiting for care for about 10 to 10 and a half months,
Wow.
respectively.
Okay.
We came in, we got this, it's like a PDF form that says, basic demographic information, what they need to be seen for, etc. The classic information, we all fill it out a million times, right?
Yeah. Right.
And it's from their provider. So now we can provide coverage. Within 14 hours, they both had appointments and got seen. And later that day, they went to the Walgreens down the street and picked up their prescription. Now, how wild is that? We went from 10 and a half months to literally under 24 hours without, nothing had to really shift. It was a communication and continuum of care problem that you're fundamentally solving. It's logistics through technology.
Okay. So what
fundamentally.
was the reason that it took 10 months prior? Why was that
Yeah.
so long? Yeah.
No, that the reason is, again, it's always an unsatisfying answer because we all experience it on when we're going through it. But when you look at the economy as a whole, you're like, it should be able to move better. And I agree, it should be able to move better. But it's really a lot of compounded inefficiencies along with kind of lack of clarity on whose responsibility things are. So handing somebody off into the ether of the world is really difficult, right? You're dealing with compliant information that's protected in many ways. So you can't just like hand it off. You can't start calling around. You need the patients to actually give you their sign off. You need the payers to make sure that they're willing to pay for coverage that happens outside, and you need somebody to be on the other side to receive it, right? We hear about provider shortages and stuff all the time these days as well. So not everybody's actually accepting patients either. So how do you bridge all that, and who's responsible? Are they being paid for it? You know, uh, maybe I make one or two calls to make sure, as a somebody who's working as an administrator at a health center, I want this person to get coverage, but after my first three calls go unanswered by the community, maybe at that point I have to move on to some other critical care that I need to provide. And little by little, you as the patient now are waiting to see if you hear, you don't hear. It's again kind of that lack of transparency problem. Where the technology piece really can elevate it is you actually get all of that what's happening in real time, and you're in the middle of it, so you can sign off and things are happening in a compliant way, in a secure way, but you're actually in charge of it, making sure when something gets stalled you can actually uh, get answers and move it along, right? Because you at the end of the day as a patient are ultimately in charge of what happens to your care, and this way, that peace of mind comes to the patient, to the provider who now needs to hand them off to someone else. You, as now the receiver of that patient, are like, great. Now I have one fewer open slot in my practice. I get to see somebody, make their life a little bit easier, and I know I'm going to get paid for it. And that now is a full package that really expedited that care.
So is that basically what you're trying to do as we sort of wrap things up here? Is your model, if I save you X amount, I collect a piece of that? What is your business model building all of this?
Yeah, so we're trying to put ourselves in the ecosystem where we go just to the folks for the services that we provide. So exactly, yes, we share in like the value that we're providing, the transparency we're providing, the increased opportunities that we're providing. Only then do we get to have uh, our money back, in a sense. And what we think about it in, I think, in a more approachable way is it's called a life covered model. So we basically become in charge of being the care navigators for these lives. And that's something we take very, you know, we believe in very strongly to really push that piece forward, where now the folks that are in under our care, it's our responsibility. Whether they need care every single day, we want to get them that care. Maybe they just check in once a year. That's also fine, right? Like whatever people need, that's what we get to be there for. They're navigators, they're guides in this really complex system. So that's definitely how we're thinking about it.
I guess I'll leave you to close this out. So where can people find you, figure out more about your business and what you're doing, and support you or latch on if they're interested?
Yeah, you can find us on all major platforms. I think the one where you'll find me is LinkedIn. That's the only place I feel like I can navigate anymore. But it's www.valoranthealth.com, and we, try to elevate voices from a really diverse background of communities and people, and it's all it's fun stuff as well, right? Like it's just so everybody knows, like I talked to Damian Lee of the Phoenix Suns about his mental health. We got to have a panel with Khalil Herbert of the Chicago Bears and
Dang.
Patrick Taylor from the Packers to talk about mental health. Like it's not just about the making healthcare really serious. It's something that affects us all. We all have joy and hardship in our lives. Let's treat healthcare with the same, gravity that it does deserve, but also it's an everyday part of our life, so we can have a little bit of fun and elevate the voices and talk about it in an open way as well, all at the same time. So we have webinars and stuff we do. Come find us, come listen in.
Sounds good. And that's Valorant Health, VALORANT health.com, right?
Yes.
Awesome.
Yes.
Well, thanks, Ahmed. You're a very incredible person. I appreciate it. And with that, the official podcast is over.